Around 1 in 12 Australians are affected with a rare disease. That's a figure comparable to the number of Australians affected with a common condition like diabetes. So rare disease is actually collectively a big health problem for Australia. Many rare diseases affect children and often shorten lifespan. So up to a third of children with rare disease die before their 5th birthday. There's around 8,000 rare diseases already known, but new rare diseases are being identified every month because of new genomic technologies that allow us to discover them. When we understand the underlying diagnosis, we can be aware of future health problems which might arise, for which the child might need medical monitoring. There are thousands of different genes which can cause rare disease. This is why we've struggled in the past when we tested one gene at a time in undiagnosed children. That traditional diagnostic journey meant that families sometimes spent months and years working their way through different medical hypotheses trying to get to a diagnosis. Timely diagnosis of rare disease is critically important. The reason is that we take better care of children and adults with rare disease when we know what that rare disease is. Individuals with rare disease who are undiagnosed are at risk of having investigations which can be invasive, can be painful and expensive. Having an incorrect or non-diagnosis can cause families real psychological hardship and have detrimental financial effects on them as well. What we've learned by using genomic tests is that a third to a half of children with undiagnosed rare disease get a diagnosis via genomics. And when we use those tests, those diagnosed kids, a quarter of those have a change in their medical management from the test. So that means that we're able to improve the medical care of a quarter of the children. That's one of the big, powerful improvements that genomics brings to people with rare disease. Australia is leading the world in some aspects of implementing genomics, particularly in using genomics in intensive care units for children. In Australia, we've implemented an acute care genomics test for the sickest children in our intensive care units, delivering a test within 3 days of receiving the sample. And that has a big impact on how those children are looked after, because we're able to give the information to the intensive care doctors right when they need it. We're calling on Australian doctors to rethink their approach to Australians with rare disease. We know that the breakthroughs of genomics have delivered massive changes in our ability to diagnose and take better care of children and adults with rare disease. And we want Australian doctors to be aware of those breakthroughs and to think about their patients and think, which of my patients might benefit from a genomic test? Which of my patients should I be referring to genetics to access the latest in genomics-driven healthcare? I first met Lily and her mum Jessica when Lily was referred to our genetics clinic. She was referred because she had been diagnosed with some problems with her vision and abnormalities in the way her eyes had been formed, and also some problems in relation to her craniofacial structures. So she has some asymmetry in her face, and the doctors who were looking after her wondered if she might have a genetic cause for these collection of health problems. Lily has had a large number of different types of genetic and genomic tests, and we have not found the underlying cause of her condition. She has a condition that is so unusual that her case has been discussed by doctors around the world and no one can give it a name. I'm confident that in Lily's lifetime we will reach a diagnosis for her. Every few years we have a new test or a new technology that we can offer to families of children with rare disease, and Lily's exactly in that group of patients. Rare Disease Day is held on the last day of February each year and is celebrated in more than 100 countries around the world. It's a really great opportunity for families affected by rare disease to come together with health professionals who work in the rare disease field and raise awareness in the general community about the issues that people with rare disease face.
We had no idea there was anything sort of different about Lily. When she was 1 day old and I was still in hospital, we had a team of paediatricians sort of approach us and do an assessment of Lily, and that's when we discovered that, yeah, basically she had been born with a genetic condition. The main symptoms they noticed were her facial abnormalities. So from that, they decided to refer us to a geneticist and go from there, basically. Lily has optic nerve hyperplasia, so her optic nerves are underdeveloped, which has caused her to be legally blind. She also has a hearing impairment, so she does have a hearing aid. She also has some brain abnormalities and basically facial structure abnormalities as well. We've never received a diagnosis for Lily at this stage yet. If we had a diagnosis for Lily, I think we'd be able to connect with other families that had the same diagnosis, would be able to, I guess, share stories, just to be able to know what the future holds for Lily. It would also make it a lot easier to explain it to other people, just having a name for it. Due to no diagnosis, we didn't know if her condition was hereditary. So having future children was kind of a 1 in 4 chance it would happen again. But that was a chance we were willing to take, and we had 2 more. Dr. Sue White was our first point of contact, who basically we met when Lily was about 8 weeks old. From there she referred us to a whole team of specialists to have a look at Lily, and we went and did some genetic testing as well. We do have a big care team for Lily, so that involves paediatrician, geneticist, ophthalmologist, audiologist, ENT, neurology. I think that covers them all. Schooling wise has been pretty stressful. With her vision and hearing impairment, we've needed a lot of support, extra support, so Lily can be included in the curriculum basically. So through SWAN Australia and through SWAN, we've had a lot of support as well, and through visiting teachers service as well for her. SWAN stands for Syndromes Without a Name, and basically it's an organisation to bring families together that don't have a diagnosis or are living with a rare disease. Yeah, Lily certainly has no problem interacting with her siblings. She plays the big sister role very well, so very well indeed. Our family, I guess, have had to reframe our whole lives since we did know Lily had a rare disease, just to know how to do day-to-day things to involve her as well. We've both found some supports and have learnt how to advocate for Lily and how to, get her involved with day-to-day things. It's important to recognise Rare Disease Day just to get the word out there, to help other families who may be going through something like that find the support that they need, so they don't feel alone.
Living with MPS SWAN just affects me in little trivial things, like I have to sometimes miss out on schoolwork because I need to go to the hospital for like checkups and tests and stuff. And also with my skating team, I'll often be slower than most people to pick up new things. But otherwise, I'm happy with my life. Something that people don't know about rare diseases is that there are so many of us, and that we can still have a condition and still fit into society seamlessly. Even though we may look and do things different on the outside, we're still normal people, the same as you on the inside.
Sinead had a lot of symptoms when she was young. She got sick a lot from about 6 months of age, a lot of respiratory type issues. She also had a lot of limited range of movement. So we noticed she couldn't put her hands in the air and move the way other kids were able to. And she also had things like enlarged tongue and a big tummy. So we knew there was something wrong. Sinead's been diagnosed with mucopolysaccharidosis type 1, otherwise known as Hurler-Scheie syndrome. So she initially was referred to a rheumatologist who referred her to a geneticist, and her diagnosis was confirmed through blood tests. MPS is short for mucopolysaccharidosis. It's a really rare genetic condition. So it's like a storage disease where a person's missing an enzyme that's essential for the recycling process of cells in your body. So without this enzyme, storage builds up in all parts of your body and can make a person really sick. Around 1 in every 200,000 people have this condition. Sinead's is an attenuated version, so I think that's even rarer. When you first diagnose, it's a big challenge, it's a shock. I think it's the anxiety and fear of the unknown. What will the future hold for your child? Is she going to feel a lot of pain? Is there any hope for her future? So that has been very challenging. There is no cure for MPS 1 at the moment. She is on a life-saving drugs program which requires weekly infusions, but it's a treatment, not a cure. We're hoping that in the future that there will be advances in medicine and things like gene therapy so that she can get one procedure and no longer has to have weekly treatments. That would be our dream. We're very grateful that Sinead has had access to this life-saving drugs program. An artificial enzyme is infused to her bloodstream each week over 5 hours. And we've seen fantastic improvements to her health, overall health, her ability to move, just being able to be active and energized each week. Previously, kids with her condition perhaps live to their teenage years, but now we have a lot of hope with her life-saving medicine, and we are hoping that it would basically mean that she lives a healthy, normal life. She's doing ice skating, she's doing very well in school, so it's been really rewarding to see her accomplish so much. People would need to know that rare diseases is probably more common than you think, that rare diseases comes in all sorts of forms, some mild, some really severe, and that people should be able to just treat people with rare diseases like any other people.
PCH6, which is also known as pontocerebellar hyperplasia type 6, is a very rare condition. The type 6 of this condition, I believe there's like 30 individuals worldwide, so it is very rare. The PCH is a condition with various types which affects people in different ways. So Ruby's type affects her mitochondria and ultimately the cerebellum and the pons in the back of her brain, which controls all her movement, her breathing, her swallowing, etc. Physically, she can't do what you or I would do. She's not able to communicate verbally her feelings or what she thinks or what she wants, her needs. But she's got so much that she offers to the world and what she's taught everyone around her. She just was failing to thrive. She started regressing in her milestones, and then it was excruciating pain till she was 3.5, told she wasn't going to live past 2 years of age. The diagnosis that Ruby has been given include epilepsy, which was the first one that she was given. Then it's been all along underlying mitochondrial syndromes. Then we were given cerebral palsy. They questioned Rett syndrome at one point. Finally, in 2019, we got the answer we were searching for, and that was via DNA sent off to Melbourne. Genetic testing played a huge part in getting Ruby's diagnosis, and ultimately has just changed the path for Ruby and our whole family. It took 10 years to get the firm diagnosis for Ruby, but we started the search when she was 9 weeks of age. SWAN, which is Syndromes Without a Name, and that is a place that we went before we got a diagnosis, but you still felt like you were connected to a wider family, sharing similar journeys, not the same, but living in a place of unknowns and all the impacts that come with that. Receiving a diagnosis for Ruby has ultimately meant that we are sharing the journey with other families living with PCH. So it's enabled us to communicate via Facebook and then building friendships through that, being able to just be a sounding board for each other when we're going through tough times and living with this condition daily. I had to give up my career, so our family went down to one income. Family fell apart pretty much in the end, and it's really been a case of being a full-time caregiver, and friendships have been affected, and just generally daily living. There's many challenges with managing Ruby's very rare disease, and they range from the physical side of things, so it's 24/7 care. It's you're doing everything for her. She's unable to move herself, so you're moving her from one chair to another, repositioning. There's sleepless nights, which is pretty much almost every night. There's all the therapy side of things. There's ongoing surgical procedures for her spine, for her hips, and also swallowing, which is a big thing. So there's lots of helping her to clear her airways and keep her safe all day and throughout the night. By creating a career that is supporting other families who are sharing similar journeys, so children with disabilities, we support them by providing quality childcare for them and the whole family. So yeah, I've reframed Ruby's very rare condition to support many, like hundreds of families in our local